So yeah, my name is Rebecca Ciatto. My grandparent, they Americanized it when we went over to America, so it's Ciatto now. So I am very grateful to have the opportunity to speak to you about radically open DBT, what the differences are to DBT and when to apply it. So I think, there we go. Okay, so radically open dialectical therapy is a treatment for disorders of over-control that was developed by Dr. Thomas Lynch. So Dr. Lynch was a DBT therapist and a DBT trainer, and he worked with Marcia, and he started to know a gap in treatment about 25 years ago, and he started to create his own model to cover that gap in treatment. So radically open DBT is effective for clients who have chronic depression, chronic anxiety, anorexia nervosa, OCPD, which is the most prevalent personality disorder, OCD, maladaptive perfectionism, and he reassesses borderline personality disorder to see if they're actually over-controlled. So I will talk about that at the end and save most of my presentation towards that. So when I'm talking about over-control, someone who presents as over-control has a predisposition to heightened threat sensitivity. So their affect might be flat, it might be constrained, or it might be incongruent to what their emotions, like what they're speaking about emotionally. They kind of live in a fight or flight mode, and their reactions to people in their environment are based off of that, so they might attack or they might avoid. They have a low reward sensitivity, so they're not going to respond the same way to certain rewards or positive reinforcements that typical DBT clients would respond to. They have a high inhibitory control, so their impulses, they have a high impulse control, and they're heightened detail focus. So if they're planning, they approach cope, they can notice the details and mistakes in people, like grammar. That's a clear one that you can tick off. So that's kind of like the overall understanding of what over-control is. It's more complex than that, but that's the gist. So radically open DBT is different to DBT and other forms of treatment because it is a transdiagnostic model that covers OC deficits throughout multiple disorders, and it's a treatment that covers the biotemperament and the thoughts, emotions, and behaviors. So it teaches you skills to how to change your body's physiological response in certain situations, and it teaches skills on your thoughts, emotions, and how you react to people in your environment. And the entire thing is manualized. It goes through 30 weeks, and every group has an agenda, and every individual therapy session has an agenda. So that way you can kind of see if it's working or if it's not working. So when you're looking at these two graphs, so DBT and some other types of therapy teach self-control. So distress tolerance skills, emotion regulation skills. If you're an emotion mind, how do you get into your wise mind? So it's self-control, self-control, self-control. And psychological well-being is based off of a high sense of self-control. What Dr. Thomas Lynch and the Radically Open DBT team taught is there is such a thing as too much control. So the middle part is the optimal control. And the people who are over-controlled, that's the people that you want to teach Radically Open DBT to. And the people who are under-controlled are the people that are standard DBT clients. So when I talk about under-control and over-control, it's very scientific, but it's basically the people who need emotion, skills for emotion dysregulation, and the people who regulate way too much already. So, and the main thing is that, well, I'll get to that later, actually. Okay, so reassessment of borderline personality disorder. So when I heard about this, I was kind of like, wow, okay, this is a new approach. So what he's looking at is if you have a client come into your office, how do you assess if they're over-controlled or under-controlled, because people who are over-controlled also express feelings of suicidal ideation. They do self-harm. They talk about feeling numb, which might be kind of like the chronic emptiness, because they have that biotemperament that is heightened threat sensitivity. They do dissociate. They have interpersonal relationship problems with anger. They often hold grudges, resentment, bitterness, which interferes with their relationships. And they do report some behaviors like overspending or overeating or substance use, alcohol use. So it looks very similar to the traditional, the client that you see in DBT. So what you want to look at is if the behavior is public versus private, and if it's rule-based versus emotion-based. So the person who is over-controlled will hide their scars under their clothes. They might do it in the same place. There might be a pattern to it. Typically, the person who's over-controlled never really shares to the outside world that they have self-harmed. It's a well-kept secret. The people that might know about the self-harm is the family, that they're like their immediate family would be the only ones that actually know. They might have suicidal ideation, and again, the family might be the only people that know. Hospitalizations are lower in the population that's over-controlled to traditional BPD, or under-controlled clients. The behavior is also rule-based versus mood-dependent. So someone who cuts in the moment impulsively because of a mood, that would be more under-controlled. And the client that thinks about cutting and plans it until they're at home, that would be the more over-controlled client. So they might think about it at 9 a.m. and they might wait until 6 p.m. when they're home, and they can do it privately. The self-harm is also typically with punishment rather than, that's the rule, it's more punishing themselves to justify something that happened in the world. So you want to try to assess as much as possible. Someone who has over-control might have a suicidal plan, and they might have it 2 years in advance, and if certain things do not line up, then they will follow through with it. So that's more the over-controlled. The under-controlled would, again, mood-dependent behavior. Okay, and then if you are a DBT clinician, the 24-hour rule in DBT, I'm going to explain it just in case you're not a DBT clinician. So the 24-hour rule is if you cut, we're not going to speak to you for 24 hours after we assess for your safety. So a person who is under control, that relationship is important enough for that to be a negative reinforcer. For the over-controlled client, they avoid. So it's like a nice little vacation for them for 24 hours, and they don't have to talk about it. So understanding that the way they respond to will kind of tell you if they're over-controlled or under-controlled. Let me see. Okay. So the anger. So anger might show up. The client who's over-controlled might hold it in throughout the day, and then it comes out when they're with their immediate family. So when you're talking to a family, the typical response might be like, Mom is completely different when she's out, when she's at work, when she's with her friends, and we get a completely different mom when we come home. So because they kind of put on a facade throughout the day, it comes out at night, and the people that are closest to them get the anger, and it might be screaming, it might be yelling, it might be threats. That would happen at home. Or if it's socially appropriate. So it's not uncommon for an over-controlled client to show their anger or show their emotions in the session with you, because that's socially appropriate. That's a therapy session, right? Or it's socially appropriate to show your emotions at a, sporting event. So it's trying to gauge, that's role-based, again, not emotion-based. And let me see, my notes, because I'm over-controlled, so I have notes. And again, the UC client would be emotion-based, and they would be public with their anger. So does it matter who pissed them off? They'll let you know. So the key when we were assessing people is to try to have them demonstrate. So when you're saying you're out of control or you're being dramatic, what do you mean by that? Can you demonstrate it to me? For the over-controlled client, because they feel so out of control, it might seem as though they were out of control in public, but their response might be, I told him that I was angry. So it was like the response isn't what you would picture out of control or dramatic. So trying to have them demonstrate and discuss the behavior as much as possible to assess. The behaviors such as overspending or overeating, again, assess, because their understanding of overeating or overspending might not be the same to someone who is, binge eating or impulsively shopping. So assessment. Okay, and then I guess to understand that, so if you're treating someone who is over-controlled with traditional DBT, the risk is that you're telling them to self-control, self-control, self-control more. So the clients, while they might not show the behavior, they're not getting better. So understanding with assessment is the key. What we found when we started reassessing clients, so I've only been here for 12 weeks, so I'm talking about the experience that I have back home. When we started reassessing our clients, we found that almost half of them, sometimes more than half of them, were actually over-controlled when we were treating them with traditional DBT. For the teenager clients who had BPD traits and they came in to get DBT, the majority of them were actually over-controlled. So assessment is key. And the main thing is that over-control, because it's pro-social, self-control is pro-social, like people like, planning, and they like people to control their behaviors. Over-control gets worse over time, whereas under-control, because it's not pro-social and the behaviors out in public get punished, it goes away over time. And so the people that are over-controlled might have these traits for their entire life. They're very lonely. And then you add the flat affect and the incongruence with their affect. And there's studies that show if you have a flat affect, you're not trustworthy. There's a lot more information on Radically Open DBT website, but there's studies that show that they're not trustworthy, and therefore they feel even more lonely, and they are socially isolated, and then that increases their psychological distress. And it's also used for clients that maybe have grown up in an over-controlled environment, or they are married, or their partners are over-controlled. So for the BPD clients to understand so that they can improve their relationship. And just for a fun fact, most therapists are over-controlled when they were rated, so just something to think about. So here's the website, and I'm happy to answer any other questions if you'll have them. I don't know if we have time.
You may mention there that you've only been here 12 weeks. You came from a different country, or?
Yes.
Right, I'm interested then, do you find that the over-controlled condition varies or is more proportionally higher in any particular culture or any particular social group, class of group, and across the age span, the lifespan? Is it more enhanced in the younger teenage group or the older?
So some fascinating questions about cultural prevalence and across the lifespan.
So I came from Texas about 12 weeks ago. So in terms of who's more over-controlled, from what we saw, it was pretty much across the board. Here, I've been working here for about 3 weeks, and half of my clients have rated as over-controlled. That would have normally gone into a DBT group. And it might have, I have a theory, that it might have to do also, you might have immigrants that come in and they might be more self-controlled, but that's also not proven. So, but that's my own thoughts.
Across the class or age groups?
Yeah, it seems to be like across age groups. When we were reassessing, it was half or more than half people who were over-controlled. There's more research. Obviously, this is new. So the manual came out a month ago. The research has been going on for 25 years. So we're trying to get out so that we can become more culturally, evidenced and to see who it would work with.
I have to say that does sound like a bit of a relief, because when you were saying it was like 80% of the teenagers but only 50% later, that indicated that a big chunk of people were just getting so controlled they dropped out of seeking help, which would be a very bad scenario, but hopefully that's not what...
Just as an additional comment, which I think speaks to both the question and your comments on over-control. In a study we published about 10 years ago, we looked at temperament traits in people with borderline personality disorder with about 300 patients, roughly. Interestingly, given that this is a group that does self-harm quite a lot, the initial hypothesis was that they might score low on harm avoidance as a temperamental trait. In fact, the opposite was true. They scored high. So it suggests that the effort is towards control. Our interpretation of that data was that it suggested the inner experience of pain was severe, and that the behaviour was, had the adaptive aspect of providing at least temporary relief, much as it's not seen as adaptive. I think that's actually quite an important perspective in this area.
Thanks very much. Well, we might move...
I just want to say one thing, just with the question regarding whether or not DBT does address emotion, that came up just before, that actually a quarter of the curriculum of DBT does relate to emotion and understanding the function of emotion and being able to identify it in yourself and how to work with emotion. So just to clarify that DBT is not just a cognitive treatment.
Thanks very much for that. Thank you, Rebecca.